Hello, lovelies. I know this topic has been long overdue. So many people have been asking for me to make a video on this. So today we are going to explore roles of a nurse in a care home. I'm sure you have seen the title already. So we are going to explain what is a care home, what are the roles of nurses in the care home, what are the types of care homes, why do we need care homes. Okay, now stay tuned, don't hesitate to subscribe, and let's get into today's business. Hello. For those that are joining us for the first time, my name is Mboyi. I am a nurse. I work and live in United Kingdom, Wales. So like you have seen, we are going to talk about roles of a nurse in a care home. What is a care home? Right. A care home comes as an institution that houses elderly people or people who need assistance of some sort in a health aspect. So, there are different types of care homes. There are respite care homes, residential care homes, nursing care homes, and many other. So, they could be privately owned or they could be under government social services. And it depends really on the mandate of the care home, a particular care home, on which individuals are going to be housed in that particular care home. So a care home is generally a home, like the name is it's self-explanatory. It's a home where we offer care. So, like I have said, some care homes are privately owned, others are under government. So, those that are under government, it means the payment to the staff members will come directly from the government. Or if it's a privately owned care home, the payment to the staff members the payment will come from the owners of the care home. And sometimes, even though that the other care homes are private, government still subsidizes, or maybe that type of a care home offers services that the government care home cannot offer to that particular individual. Take for an example, if it's someone who needs nurses 24/7 and there is no care home that can accommodate his needs, but the care home that can accommodate his needs is a private one, the government can pay for that individual to be cared for in a privately owned care home. So, even though they are private entities, there's still an assessment that needs to be done for someone to be accommodated in that particular care home. So no one just goes to the care home because they are elderly or because they suffer from some disease of that needs to be cared for by the professionals like nurses. So this brings me to the roles of a nurse in the care home. Okay, before admission into the care home, first things first. Like I said, there are different types of care homes. So there are care homes which house people who have physical disability. There are care homes for dementia, Parkinson's disease, and old age. So if this is a nursing care home, it needs a nurse 24/7. If it's a residential care home, it needs a nurse here and there, not 24/7. If it's both nursing and residential, then it needs to have a nurse 24/7. The staffing patterns will depend on the number of beds in that care home. So it can be something from 10 beds up to 60, 65, 80. So it depends really on the number of beds in that care home. So it doesn't matter now to mention the staffing levels, but before admission, then this person would have a diagnosis that warrants him to have a nurse 24/7, which could be dementia or advanced dementia, all types of dementia, Parkinson's disease, and old age on its own. So the team that will have to assess this person to make sure that this person is eligible to be in a care home. It's a huge team. It's just a multidisciplinary team that includes doctors, social workers, lawyers, veterinary health professionals, nurses, psychiatry nurses, community health nurses, um, at some point, dentists, podiatrists, ophthalmologists. Like, it's a huge team that assess the needs of this individual, involving family members. The main thing for assessment is just to come up with a nursing care plan on for this individual. If the person is still able to consent for himself, this means they still have capacity. They will give a consent, and then the whole team will go ahead, assess the person, and then come up with care plans involving family members. If this person does not have capacity to consent, then anyone, any relative, or any it could be a social worker that has a legal lasting power of attorney for social health care, for healthcare and social needs, to consent for the care plans to be put in place for us to be able to care for this particular individual. So the care plans would be personalized, really. It does not encompass, it's not a generic template, it's a personalized care plan, but there are guides on how to formulate care plans. So the care plans would be anything from nutrition, mobility, skin integrity, sleeping patterns, wishes in the time of death, DNA, do not resuscitate documentation, also medications. So it's just a huge thing, but there is those guides on how to formulate care plans in a care home. So after you have had chance to formulate care plans, it needs to be signed for by a relative or anyone who holds a lasting power of attorney for healthcare, and yourself as a nurse or the home manager. And then we move on to risk assessments for this individual that is going to be living in the care home. The risk assessment is done by a nurse. So it could be you or the deputy manager or the manager herself or himself when they do the initial assessment before admission. So they will do the risk assessments, and then when this individual comes into the care home, your role as a nurse is to continue doing risk assessment throughout the stay of this individual, including where if this person is for respite care, which is a day care or weekly care or a monthly care or a short stay care, and you do the continuous risk assessments. Risk assessment could be to prevent falls, to maintain good skin integrity, just to rule out the risks that this individual may have. And it really also depends on level of dependency. If this person is completely dependent on carers or on healthcare professionals, this means the risk assessments will be more complex. But if this person is still able to fulfill other needs by himself, then the risk is not much, but you will have to make documentation that this person can feed themselves, but they need assistance to locate where the plate is. If this person does not know how to hold a spoon, this means for you to prevent risks of malnutrition, you will have to feed this person. So that's the continuous assessment that you do throughout the stay of this individual in your care home as a nurse. Now, the most important things to note is that the care plans needs to be updated regularly. It could be monthly, quarterly, or 6 months, after every 6 months. But as a nurse, when you see a change, any sort of change, you need to update the care plan on that. You don't just update the care plan, you need to involve the relative, the next of kin, whoever is holding a lasting power of attorney for healthcare, and then your manager. You don't just do changes by yourself. You inform the doctors, the social workers, and then the care plans are updated. Okay. Another role of a nurse in a care home is on medications. Yeah. Take note that in a care home, there is no pharmacy, there is no pharmacist, there is no pharmacy technician. You as a nurse, you are responsible for medications, and there is a protocol. You will not be allowed to dispense any kind of medication, including the over-the-counter medications like Bopanado. You won't be able to dispense those before you complete a training in medications. So after you have completed your OSCEs and you have your PIN, you will have to undergo training in medication dispensing. So after you have completed the training and you've gained your competency signed off, that's when you'll be able to handle any medications in a care home. There are also controlled medications because there is a nurse 24 hours. When you enter in your shift, the nurse, or it depends on care home to care home, but 2 nurses need to check the control tracks together. That's the point number 1. Your main issue is to check tracks that they are still balancing. That's your role. The second role in medication is to order, is to receive them, is also to destroy the ones that are no longer needed, the expired ones, or if the doses has been changed, you need to destroy them. So roughly, you are ordering, you are receiving, you're checking, you're destroying. That's you. So you also dispense medication. In some other care homes, senior carers are trained in dispensing medications. This means they will be dispensing medications to residential service users, or the nurse is the one administering medications. So some of the residents or service users that's in that care home, they still have capacity and they wish to dispense medications themselves. So this means you won't need to go and give them. They will pop the medicine and take them without you going to them. In such cases, that particular service user need to have them under lock and key, because in a care home, like I said, there are different people housed in one huge building, and some are wanderers. They go all in, up and down, even though it's not allowed for someone to invade other people's space, private space, but sometimes it happens. And you find that if there are drugs lying on the dressing table, they might take them, and that could be a very fatal error that could happen, and it might cause too many things. That person could be allergic to that medication, or it could be fatal if it's sedative, or if it prevents, it lowers blood glucose levels. Like, there are so many things that can happen. So if one service user wishes to keep their medications in their rooms, they need to have them under lock and key, meaning they should have a safe locked at all times. And it's your role as a nurse to make sure that that box that contains medication is locked all the time. So yeah, that is all about medication. So When you dispense medications, there are different protocols and policies governing medication dispensing that you need to follow, and even the guidance is there with NMC standards and safe medication dispensing. There is another entity called NICE that have policies on medication dispensing. Another thing is, after you have given medications, then documentation. There is this document called My Charts, which is a medication administration record. After you give the person a medication and they swallowed it, you sign. If this person spit it out, there are codes on the My Chart. It could be S for spitting out, or S for sleeping, R for refusing, D for destroyed. Yeah, there are those codes. So you put a code for you put a code that will match what has been fulfilled in medication administration. So yeah, that's the things. And for you to have medications in check, you have to do reviews with the pharmacist, with the GP, and most of the times the pharmacist, they already have a schedule for the care homes that they serve, that on Monday I'll be talking to Mpoi with her 3 service users to review their medications. And if you think this particular person is no longer like if one track is no longer indicated, you can communicate that with the GP. So like I said, care home is a home. Like you in your house, you're like a nurse works as a middleman between a huge multidisciplinary service. You are a middleman between your service users and their doctors and their pharmacists, social workers, family members, and all those things. So in terms of medications, you liaise with GP and pharmacists to make sure that all medications are in check. Okay, another role of a nurse is to make sure that every documentation is up to date. Like every documentation. When I say every documentation, I mean everything from progress notes, the care plans themselves, like the weights, the vital signs, the nutritional assessments, risk assessments, and all those. And then there is one particular documentation that I'm obsessed with. It's a fire documentation. Like I always imagine, like if there was to be a fire in my workplace, how are we going to manage? Because if we are saying there are about 10 staff members on duty and you have about 40 people that you are caring for, how are you going to rescue those people out of the building safely if you don't know how to move them? Because documentation on fire safety will tell you exactly what to do with the next person in room 1, the next person in room 2, room 3, so on and so forth. Because if you don't know how their mobility is, let me tell you, you are not going to be able to rescue anyone. So I'm obsessed. I'm obsessed with fire documentation. I make sure that it's up to date, and if I see any needs for updates, then I will talk to the manager or the next in the hierarchy to update the care plans in terms of mobility for safety purposes. When you know exactly what to do in terms of emergencies, then you won't struggle. You will be able to rescue anyone that needs to be rescued, bearing in mind that you need to protect yourself too and the ones that you are working with. So another role of a nurse in a care home is to micromanage staff members, like the subordinates. It's a challenging one, but unfortunately, because you'll be the most senior on duty, that working on the floor, then you are going to be micromanaging people. And remember, you're working with adults with different level of expertise. Some are even more qualified than you are, and it's really challenging. But you have to make sure that you build your team, because if your team fails, let me tell you, you are a failure yourself. So you don't want to always have a failing team. So you build your team, you empower your team, you work together, you help where you can. You can actually do everything as a nurse, because actually, when we are in training, we are trained to do almost everything in nursing school. So empower your team, work with them, ask questions, encourage them to correct each other, So micromanaging involves allocations and making allocations, delegations, corrections of mistakes, reflections, Yeah, so that's one of the toughest roles of being a nurse in a care home, because you will be working with people with different level of expertise, different skills. Like, it's gonna be challenging, I kid you not. You have to come with a clear mindset, because if you are micromanaging people, adults for that matter, yeah, you need skills, you need patience, you need to have resilience. Oh my god, I can go on and on and on with this one. But yeah, that's one of the roles of a nurse in a care home. Another role as a nurse, you are coordinating with a multidisciplinary team. This starts from the beginning, from when the person is being admitted. After you have admitted this person, you are going to register your resident with the local GP. In United Kingdom, you don't just go to a clinic that you wish to go to. I think it's practiced everywhere in the world, but in my country, people have liberty to use any other health facility they want to. But in the United Kingdom, you use the GP that you are registered with. Otherwise, you will be going to hospital. So if it's for any other minor ailments that don't warrant you to be going to hospital, then you will be going to a local GP. Firstly, before you do anything, you have to register with the local GP. The same thing with your residents. When you admit them, you register them with your local GP. After they have been registered, then the GP will liaise with the local pharmacy that we have this person. Also, then the optometrists, audiologists, dentists, podiatrists. So there is this incident. This is funny even today. One day, one of my residents had long and toenails. I wanted to cut them, and my colleague just told me, no, don't try it. There is a particular individual under a health profession called podiatry. These people come to cut the nails of our residents. So the podiatry is a health measure where people specialize in toenails. They cut them. If there's any issue, then they will deal with it. They will give out a prescription. They will do the tracing. They will tell us what to use and when and how. So don't attempt to cut anyone else's toenails when you arrive here. Okay? Yeah. There are also other health professionals like community health nurses, community health mental health nurses. There are also, what else? Tissue viability nurses, the bladder and bowel team. There are so many that you as a nurse, you will have to provide a linkage between themselves and your residents to fulfill every need, a health need of your resident. All right. I think this is roughly what are the roles of the nurses in a care home, and they are not limited to this, don't get me wrong, but most definitely all the care homes go through this that I have mentioned. So if you want to work in a care home, roughly know that you are going to be doing this. In a care home, I think I have mentioned in one of my videos that there is a manager, a deputy manager, a clinical lead, a nurse, senior carer, and carers. Then there will be kitchen staff, maintenance, cleaners. So those people form a complex team that helps the residents in a care home. So sometimes for entertainment, there will be singers coming in, children coming to visit. Um, uh, okay, one more thing that I nearly forgot is that other care homes allow the residents to come with their pets like dogs, cats, lizards, snakes. It depends really. So sometimes residents are allowed to come with their pets. So as a nurse, you will have to make sure that those pets have been fed and their health status is up to date, the vaccinations. So you will also have to provide linkage with the local veterinary health professionals. All right, that's roughly what a nurse does in a care home in Wales, where I am based. I don't know other parts of the United Kingdom, but this is roughly what to expect as a nurse if you are willing to work in a care home. So the care home houses people with dementia, Parkinson's disease, what else? Yeah. So thank you guys for watching this video this far. I will see you in my next one. Don't forget to subscribe, like, share with your loved ones. Bye.